I want to talk to you today about some of what we're doing over in our medical center. I've worked for UC San Diego for the last 13, 14 years, and in the last few years have shifted over into our medical center, which feels like a totally different world to me from campus. But there's actually a lot of commonalities, and it really is all UCSD, and I think there's a lot of partnering that we can do. So we are early in a journey, and I'll probably spend the first 10 minutes talking about why we're doing this and why this is the approach we took, and a little bit of how it's different from what we're doing on campus, and then some of the impact that we've seen even this early in the and we call it a journey. But in 2018, the CEO set forth these priorities, and basically we need to improve our operational performance, we need to grow, and we need to develop our team members. And so it seemed like a perfect fit to really focus on a culture of continuous improvement as a way to help achieve these goals. And really thinking about, at the very beginning, what it's about is the highest quality of care for our patients. But in addition to that, how do we make it easier to do the work, right? How do we make it easier for us to deliver that care? And by the way, there's a ton of other benefits. And so it was kind of a no-brainer, to be honest. They'd seen a lot of the benefit over on campus from the implementation, and one of the biggest tenets was that we're not doing lean just for lean. We're doing this in support of and as an enabler of all the other things we're trying to achieve. So whether it's a quality initiative, organizational performance, our employee satisfaction, our patient satisfaction, that this is really an enabler of all these other things. It doesn't exist for itself. And I think that building something like that has been a really interesting thing to figure out. How do we add this into the fabric? And understanding that people don't feel they have a ton of time for something in addition to. It's really been a journey of figuring out how to make this part of how we do our work. And so you'll see that approach throughout this. And a big piece of this was understanding we wanted this to be part of the fabric of our work, not something where a consultant comes in and makes some recommendations and it's kind of a flavor of the month. And so that's also been a really foundational piece in terms of how we're rolling this out. We really want this to feel like UCSD. And so whether that means adapting the language, connecting it with other core things that are happening, really thinking through how we have consistency throughout the organization and the rollout. And we decided in the end, our vision for this, if we're going to achieve our mission, we need to create 10,000, that's all of our physicians, all of our nurses, all of our staff, all of our central support teams, 10,000 problem solvers who are relentlessly improving the value of care for our patients every day while loving their jobs. And that's what I get to do every day. It is so awesome. It's a total dream job. So why did we decide this is about creating problem solvers? It's about people. There is no better reason to do this kind of work and to make a commitment than to help our patients, help our caregivers, help our support teams. It is absolutely about our people. And if you look at, this is from the SHRM survey, the top 9 contributors to employee engagement. If you look at what lean is all about, it's about partnering with each other to solve problems. So building relationships with your coworkers, working at the top of your license and training, right? Thinking about value add in terms of how you spend your time. So being able to use your skills and abilities, one of those 8 wastes is non-utilized talent. Feeling the meaningfulness of your job. I think this is actually really, really important part of this, because through the continuous improvement rollout, a big piece of this is aligning to the organizational mission, so that down at every single unit level, every single individual level, there's a cascading of what are you doing every day that supports the mission, and having that connectedness throughout the entire organization. So really tapping into meaningfulness of work. In terms of the opinions about engagement, feeling that you can meet your work goals. A lot of what we've been rolling out is a management system, a daily management system where we actually call it a daily engagement system, where we are having conversations on a daily basis. There's escalation pathways that go all the way up to the C-suite if needed, to basically escalate Are we able to serve our patients today without harm and without delay? We also have, kind of going the other direction, this alignment piece, where institutionally we want to be a high reliability organization. Well, how do we achieve that on a daily basis? Take those little stair steps towards achieving that. And so huge piece of feeling confident that you can meet your work goals if you can clear the barriers out of the way efficiently. Feeling determined to accomplish them, having a clear understanding of organization's mission and vision. In terms of behaviors, I think this feeling that you are part of a team that doesn't give up. A lot of that is creating the management system that allows for success, right? Problem solving together, communication, two-way communication is absolutely critical to feeling like you can be successful in your job. Feeling like your colleagues quickly adapt to challenging or crisis situations. In our industry, whether it's healthcare or higher education, our environment around us is changing so fast. The regulations are coming down so fast. There's really an absolute imperative that we adapt and change and flex. And we can have a plan, but we need a much more agile planning process, a more responsive process. And I think a lot of the lean management methodologies support that. And then employees are encouraged to take action when they see a problem or opportunity. This is a third piece of our management system, which is everyday improvement, empowering employees to submit ideas for innovation, teaching our leaders to coach for problem solving. So instead of just, well, we tried that 3 years ago, oh, well, it didn't happen, I'm not going to ask again. Actually encouraging the innovation on a daily basis. What ideas do you have? How can we work on this? This has been a problem. Seems like it's a pattern. What should we do about it? And then actually, from a leadership standpoint, clearing the path for your employees to be able to problem solve. So lean, I think, will directly, absolutely touch on all 9 of these drivers for employee engagement. We talked about this a bit, but really taking the approach, not just sending an analyst in there to go solve that problem over there, but engaging the people who do the work in improving the work. So our mission is really to develop a culture shift, a culture of continuous improvement. And going into this, we had to understand our current state. And so we looked at, can we articulate what problem we're trying to solve? We're not doing this just to do this. Why are we doing this? What do we need to do so people feel they have confidently the skills and capabilities to be successful operating in a different way? What leadership behaviors and management systems need to be adjusted to support this? How will we, what is the common set of tools that we're going to use? There's a ton of best practice out there. So what is the UCSD version of this going to look like? And understanding culturally what's our starting point so that we can meet the organization where it's at and then go together on a journey forward. And so what we did in early 2018 was a proof of concept. We ran a few process improvement workshops. We demonstrated that doctors are going to like this, nurses are going to like this, staff are going to like this, that it's possible to do process improvement in healthcare at UCSD. And that went well. So we did a 1-year pilot in ambulatory, which is not our ambulances. That is our outpatient care. And we saw a ton of success there. And so our mission this year is to really roll all the way through to our inpatient side. And we put together a team. You see many of these people in the audience here today. What's interesting about the team we put together is about half the team comes from other industries and careers in process improvement, like true senseis. The other half of the team is our own people who know our operation, know our culture, and so when we bring those two sets of expertise together, we're able to make something that really works well here. And so we approach the rollout from these 5 lenses. You'll see it ties back kind of to that key consideration slide, but we decided we needed to have high impact improvement events with organizational celebrations. So every Friday we have a report out where we celebrate major changes. We needed to roll out training that incorporates not just the lean piece, but it connects the dots to the other initiatives going on. So developing an in-house training in partnership with UCSD Extension, that's been really exciting. The daily engagement system that I mentioned, this is daily huddles where teams get together and they look at, are we ready to do our jobs today? What escalations are there? Any improvement we need to do? How do we align to organizational goals? And have those team interactions every day, thinking about improvement as the kickoff for the day. And we have a tiered escalation. So those huddles happen, at the front line, management, directors, C-suite, and so there's a really nice institutional alignment there. And then the process for setting goals and sticking to them. So this is the other piece that's been really critical, is thinking about our strategy deployment and how do we use our lean management system to support achieving that strategy. And then leadership development has been a huge piece of this. So we talk about improvement in these three areas. This is our visual for our management system. So the improvement events, the projects, are kind of the back wheel of the bicycle. They're the big thrust forward. The steering wheel is the alignment piece, which kind of allows us to make sure we're all headed in the right direction. And then that front wheel is actually the biggest piece, which is the sustaining the gains, that we don't want to slip back. And so how do we do this all the time and use visual management and other lean tools to help us make sure that we're ahead of this? And obviously on the foundation of focusing on who we're serving and thinking about improvement by engaging the hearts and minds of everybody in that work. So early in the journey, there's a lot of trust the process. This is a real mantra for us that we need to be consistent and stick to it. We're seeing a lot of early successes, so that's very exciting. In the first year to kind of institutionalize this, a lot of the effort was spent on building a foundation. And so we've rolled out basic and intermediate training. That's basically your yellow and green belt levels. Right now we're developing the in-house version of the advanced training. And we're also going to be creating an apprenticeship for basically like a real advanced practitioner. And we have, as I mentioned, the monthly report outs where we celebrate improvement work that's happening across the organization. We've been doing a lot of work to develop pathways so we can collect voice of customer and include our patients in the improvement work. The daily engagement system, as I mentioned, in ambulatory, we've got over 600 people huddling on a daily basis. That's 20% of the organization is huddling. The rapid process improvement workshops, we've been running at a pace of just about one workshop a month. There's about 6 weeks of pre-work, understanding the current state, a week intensive, somewhere around 10 people, sequestered in a room for a week, piloting, simulating, prototyping, refining, and then coming out with an action plan to implement those changes. We've built in accountability where 30, 60, 90, 180, 360 days, we actually make sure that those gains are sustained. And we have, put a lot of content on the website. We've created a balanced scorecard to measure the impact of the work. A lot of standard work's been developed. The lean coaching strategy, we've been working with HR to align with other coaching strategies, making sure that we're actually teaching our leaders how to develop problem-solving capabilities on their team. And then we put a backbone support team together. These are the workshops that we have run. In the first year, you can see it covers all different parts of our organization and has touched on very different purposes, but very patient-centric. The results from our pilot, we, in our first year, decided, let's not even worry about financial impact at all. It's really not what this is about. It's really about engaging people in problem solving on a daily basis. But we went back and we just looked at some of the bigger initiatives and just decided to put some numbers to it. And without even trying, the program, paid for itself 4 times over. And you can see, in addition to financial benefit, some of the biggest value has come in quality improvements, satisfaction improvements, getting our patients in, which is it's a big issue for UCSD. How quickly we can get patients in to see our amazing doctors has been one of the biggest hurdles we need to overcome. And so this has been really interesting. I think also looking at risk avoidance, getting our geriatric patients into palliative care, getting those screenings done, our kidney transplants. Once a referral came in, it was taking on average 6 months before they would get in for an appointment. That was reduced to 2 months. And that's because there's a ton of insurance and kind of screening that has to happen, but tremendous improvement in just the first year. So a lot to celebrate. Even thinking about administrative burden, we have a We Listen line, which is a complaint line. Over 50% of those calls were coming in there not really for the purpose of that line. And so helping look at process engineering to route those to the right place so that we have first contact resolution. And that's been actually really significant impact on quality there too. We've, in our mission to engage 10,000 plus people in problem solving, we've, in our first year, engaged about 1,200. And so you can see we've got people, these may not be distinct people. Some of these people may be in more than one of these buckets. But we've got over 600 people huddling on a daily basis. We've got 460 people who went through lean training this past year that we offered. And even more that we've sent through Extension's Black Belt program in the last year. And we've had over 158 people participate in these workshops. And that has created such momentum. We're partnering with Extension because we can't keep up with the demand on delivering the trainings. And so we are going to be tripling the number of trainings that are offered in the next year. And we have actually all the trainings that are posted right now are completely full. We literally can't keep up. The momentum is so strong. So that's very exciting, really good indicator of people's willingness to kind of jump on board with this. And the feedback's been amazing as well. People are feeling like they have the tools, the confidence to start doing this work. And I think that's probably the biggest thing, is having kind of this common language, this common framework, the pathways for escalation, feeling like you know how to remove the barriers, you have good ideas. How do we actually, we hire some of the most talented people. How do we allow them to actually bring that into the workplace every day? And that's a real win-win for them and for UCSD. So we've been really happy. I think this visual here of spreading the light, I think we're kind of like only at that second box. Like we've just started and we're starting to feel it amplify. But our vision is that this really spreads throughout the organization, brings a lot of hope, brings a lot of value. And I'm looking forward to sharing with you how it's going next year. Thank you.